Okay, hello everyone. Welcome to Warrior Women in Business podcast. I believe we're on episode 79 today. And to me, this is the most exciting episode.
Oh,
It really is.
exciting.
It really is because Warrior Women in Business, if you don't know about Warrior Women in Business, for years we've been helping women in business, but the conversation about families comes up in pretty much every conversation.
Mhm.
And one thing that I've noticed the fact that powerful women in business have a hard time balancing families, even starting families. Yeah. So I am here at Spring Fertility Clinic in Long Island with the lovely Dr. Chantae Sullivan-Pyke. Is that how you
Yes,
pronounce your name?
yes.
Okay. Sometimes I screw the names up, so thank you
You're
so
doing
much.
great. Thank you.
And I've asked her to be on. We're here, we're doing a little bit of tour and learning about the practice, which is amazing. But I've asked her to be on to like get to the heart of what's going on in
Mhm.
reproductive health. She's a major advocate, researcher, educator, keynote speaker in the space, and to pick your brain a little bit about the practice, how women can balance these things and get past some of the obstacles when it comes to fertility, which I'm sure
That's right.
there are. So
Mhm.
before we get started, I would like to just give my audience a little bit of your bio and talk about Warrior Women. So, Warrior Women in Business, for those of you that are new to Warrior Women in Business in the podcast, is a member-based organization where our intention has always been to collaborate with other women's organizations and support women in business and women in the arts. We do a lot to support women in the arts so that they can both grow economically, which is very important, obviously, but also grow their families and be able to have proper physical health, mental health, family health, and business health. And this is what we do. So we do it through our podcast. We have live events that we host, not just Warrior Women in Business, but with many of our partner organizations. They're very fun, actually, and educational. So lots of ways you can get involved with Warrior Women in Business at warriorwomenbusiness.com. But the reason I'm here today and the woman that I'm so honored to speak with today and be working with, she's a double board certified reproductive endocrinologist and obstetrician gynecologist.
Yes.
And so what's interesting about that to me is sometimes as a woman, you might just go to the gynecologist, right?
Mhm.
Oh, I want to have a baby, or, I need to have my annual checkup, or, whatever. So I'm going to run to the gynecologist. But the endocrinological piece of
Mhm.
it, the hormonal piece of it, how the body works together in those endocrine systems and those gynecological systems, the interlinking is so important. So
Absolutely.
I love when I saw that, I personally got really excited because
Mhm.
you don't see that as much,
That's true.
you know. She's a physician leader, she is an educator, researcher, and I think the most important thing for me is an advocate
Mhm.
to helping women through reproductive health, right? So it's not just conceiving.
Yeah.
There's the financial piece of it, there's the hormonal piece of it, there's, I think, the mental health piece of it, right? That I don't have a child yet, but that
Mhm.
I think is probably a big piece of it, right? So I'm sure
Sure.
there's a lot that you hear as a doctor
Yes.
with the women,
Oh my
right?
gosh.
I mean,
Absolutely.
tons, right?
So much.
So I'm going to jump right into our questions.
That's great.
And
Thank you so much for having
no,
me and for
listen,
being here.
thank you so much for having us. It's
A
really,
pleasure.
really is a pleasure. Okay. So first question,
Mhm.
in today's world, it's a tough world.
Yeah.
To be a woman, to be a powerful woman, to be a successful woman,
Mhm.
and be a woman,
Yeah.
you know what I mean?
Yes.
And I know you have children,
Right.
correct?
I have two kids.
2 children,
Mhm.
and you're doing all that you do here.
Absolutely.
So talk about a little bit about how in today's world a woman can have a powerful career, a family, think about maybe expanding their family,
Mhm.
and kind of do it all but still have balance.
Yeah. Such a great question. I
Yeah.
think it's the question we're all asking ourselves.
Yeah, absolutely.
And I still continue to ask myself. I think being a successful woman may look so different for so many women, right?
Yeah.
That may include children, it may not include children. But one of the things I find, with, my patients and just my day to day is asking the question, if the answer is maybe I might want to have kids at some point, it's worth just exploring what your options are.
Yeah.
For some people, it might mean having children in their 20s, right? And having or having children in their 40s. There's such a spectrum. I think
that's a really good point.
Yeah, in the US in general,
right?
There was a piece in the New York Times not too long ago indicating that there were more women having babies in their 40s than in their teens, most recently. And so there's been a shift in our society. And one thing that we have to realize, which is true, is that there are changes that happen in our eggs and just biologically as women as we get older. No matter how healthy we are, how much exercise we do, how healthy we eat, they're just biological changes that happen.
Natural.
And it's natural.
And you have to embrace it, right?
We have to embrace it.
I think that's a big thing.
And we can prepare for it, right?
Mm.
And so that's where egg freezing might be useful for some people. And, exploring, as you mentioned, the financial piece of it.
Absolutely.
There are options for financing if that's something that's interesting to you. And, just really having a conversation with your OBGYN that may indicate, hey, maybe it's a good time to see a reproductive endocrinologist and fertility specialist like myself. Or you might choose to go directly to an REI, such as myself, and say, hey, I'm thinking I might want to have a kid in the future. What does this look like? What might my options be? I'm not sure. That's just, a conversation you can have. No obligation. You don't have to freeze your eggs. It's just, what are my options?
And let me ask you, when they come in for a consult, right? Is that working with you? Is it something that's like, it's a consult that can develop into something longer in terms of, I'm sure they have so many questions that's not answered in one visit. So can you talk a little bit about how that works?
Absolutely.
Yeah.
And so I see many different types of patients. I might see that 30-something-year-old woman who wants to potentially delay her fertility for the future. And she might be thinking about freezing her eggs. I might see someone who's had multiple pregnancy losses, who's looking at it from a different perspective. Everyone will start off with just a basic transvaginal ultrasound. We want to get a sense of how many follicles, which are the little houses in which our eggs live in our ovaries. So, we do the
Is that related to FSH?
Our FSH levels or hormone levels may be high if our egg reserve is low. And so, yes, the hormones we also check at the same time we do those ultrasounds. So at an initial consultation with me, we may have a full, hour-long visit talking about you as an individual, because every single person is different. We all have a different medical history, different like family history, which dictates kind of our situation. And so, we do a full history, we do a transvaginal ultrasound, check some hormone levels. Some women may be having irregular periods or no periods at all. The reason for that can differ. It could be your thyroid. It could be PCOS, which has now been renamed to PMOS, polycystic ovary syndrome. It's been renamed. So there's so many things that can contribute to our fertility. Some women may have fibroids, which are benign tumors in the uterus. So there's so many things. So we really try to individualize the care, and that's really, I think, the most important thing.
I agree with you. It's not I completely agree with you.
There's no one size fits all.
So let's talk about how you came into this position today. What led you here a little bit, and then why are you, I could see the passion. But why are you so passionate about moving into the future? So
I've always been passionate about women's health. I think as a child growing up, I know I was going to be a doctor. I was wanting to be a doctor. I personally saw women in my life have miscarriages, fibroids, heavy bleeding, hysterectomy. So women's health was kind of a natural path for me. I, also had incredible mentors in reproductive endocrinology and infertility, in research as well. And so the combination of the research, just like the medicine and being able to really impact people's lives in such a positive way, really attracted me to this particular field. And so I actually have been practicing in New York for now since 2018. And, came to Spring to was recruited to start this new Long Island location. And I'm really proud to be a part of this incredible team of people who really care.
And all women.
Our office is all women.
I was so excited when I walked in here. I was like, It's all women.
I know. You know what?
It's very cool.
We accept and love the men, our founders, Dr. Kresge and Dr. Tran.
To see that.
It's wonderful.
Yeah, it's so like warming, right?
Yeah. And so many of our patients are looking for that. I have, some women who have had like really tough histories where they really only feel comfortable with a female provider.
Of course.
We really are able to provide that. And so I actually live in Long Island. My husband grew up here. We're raising our kids here. It's just been a really nice, it's been a dream actually to really start something that feels so personal, and to know that we can grow this practice to really, help our neighbors and friends in the area.
I love that. And community is so important when it comes to care, right?
Really important.
And yeah, absolutely. So, and talk to us a little bit about Spring in terms of the location.
Yes. Yeah.
How it started.
For sure.
It seems like it's growing very rapidly.
Yes. Spring Fertility was founded by our two physician founders, Dr. Nam Tran and Dr. Klatsky. Both came from an academic environment. Dr. Tran was at the University of California, San Francisco.
Okay.
And Dr. Klatsky was at Albert Einstein. You know what? These are great institutions. Provide great care for patients, but I think both of them who, they noticed that we could do better for our patients in terms of that personal attention that our patients really wanted and craved. Many people feel like they're a number when they go to see a fertility doctor.
Of course.
And
it's true.
Yeah, it's true.
No, it is true.
And and so our founders really noticed that. And I think all the physicians who joined this group felt similarly, like we wanted to give a better sort of experience for our patients.
Really caring.
Yes, really caring. Without compromising the science, right? The science has to be there because
yes, of course.
And so we have really wonderful labs. So they started in the Bay Area and expanded through the Bay Area in San Francisco, they're in Oakland. We opened in New York City in 2021, and as they were doing really well in New York City, really wanted to expand into Long Island, and that's how I came to be a part of this group. Just an incredible group of people who really want to help our patients. So
I love it. I love it. It's great because I haven't seen this.
Yeah.
A fertility clinic that is growing. Usually I see the independents.
Right.
So it's interesting.
It feels independent, though it's a big group of people.
Yeah,
right?
That's really nice.
It's awesome.
And that's important in medicine today.
Yes. Yeah, we don't have a lot of that.
That would be like 12-hour conversation.
Absolutely.
I'm gonna stay away from that right now. But okay, let's talk a little bit about what type of female patients, what type of patients come to the practice, and like what are the challenges that you see kind of just in general.
Right.
A little bit.
Yeah. So like I mentioned before, we see a range of people. Women who are, high power executives who potentially are delaying their, fertility for future.
Yes.
There are people who are maybe trying for their second child who are now having a more challenging time. I see people at late stages where, they've tied their tubes, but they have a new partner and then they want to have more babies.
That's so interesting.
Yes. There are women who perhaps are a bit older, even perimenopausal, looking to grow their families with donor eggs. Single moms by choice, they maybe don't have that partner, but they want to have a baby of their own. Same-sex female couples, there's so many options.
Yeah.
And so we really get to do a lot for, incredible people every day. In our Long Island location, we do inseminations in the office, we do semen analyses, same-day blood work, and of course, all those ultrasounds, we do our egg retrievals in New York City, because that's kind of how we set things up.
Yeah.
Maybe at some point we'll grow into a bigger enterprise out here, but it's really a nice, seamless operation. And I think our patients really appreciate that. So we really, span a whole range of different people. And even insurances, we would mention the financial piece earlier. So, they're folks who are self-paid, folks that are, insured, and, it really helps with the whole access to care part of it.
Let's get into it because you brought it up.
Sure.
The financial piece in terms of referring people to maybe, I don't know if there are. So the question is, are there financial resources for women and what does that look like beyond, because it's not insurance, straight insurance. So
wow.
Just talk about that a little
Let's
bit.
chat.
Because that's that's a misnomer. I don't think that people really even understand that.
I don't think people really know as much. for whatever reason, it's not as public, right?
Right.
However, there are two different pieces here. There's our egg freeze piece and there's our fertility piece.
Okay.
So New York is a mandated state where, fertility coverage is mandated.
Okay.
What does that mean? So employers who have typically like 100 or more employees are mandated to cover.
Oh, yes.
If they're New York based.
Right.
And so there are going to be different, contracts, right? Of course, but there is most times people have some coverage for infertility treatment.
Okay.
Medicaid doesn't cover infertility treatment, but it does cover, the workup in many cases. So even a patient who doesn't have private insurance could, get their blood work done. They could get their ultrasound.
Yeah,
they
right.
could get their
right.
pubes checked and perhaps look at options for paying for their treatment if needed.
Okay.
Fertility preservation, like egg freezing, generally not covered by insurance.
Yeah.
However, there are certain employer, benefits that do cover. And so never rule it out. I always tell my friends and colleagues, talk to your HR, see what your benefits may be, because let's say your insurance is not in network with Spring Fertility, but you don't know, does your employer also offer some kind of fertility benefit that gives you that? So it's always important to have a conversation, and anyone who calls our office and has a conversation with our team can find more information from our financial consultation. So I would never rule it out if it's something you're thinking about.
Yeah.
And there's also payment plans and things. And so there are options, I think, is really the takeaway. I think people generally think it's just too expensive.
One other question on that. Third-party resources.
Yeah.
I've seen those.
Yes.
Third party, I don't know if they're I don't really know what they are. They're nonprofits maybe for financial support around fertility.
Yes.
How does somebody like navigate that or understand that? Because I've also heard about that.
Right.
Yeah.
So there are different options. Perhaps like let's think about some patients who may have like cancer or a diagnosis, a medical diagnosis where their treatment could impact their fertility. There are a lot of companies that help with that, help with the medication coverage or help with, different pieces there.
Okay.
There are also like patient buy. There are other like finance options for people who just, don't necessarily have a medical reason, but they need some assistance with paying. And like Spring Fertility also, the egg freeze benefit, there is a payment plan there.
Yeah.
And so there are those options. Other third party things I don't know off the top of my head, but there takes a bit of research. Yeah, it takes research. But there are certainly those things, those options on the market.
Okay, I love that. Now, when you're on the advocacy piece, you've done speaking, right?
Absolutely.
Yeah, of course. So just talk about a little bit about that, like in terms of when you've been called on to speak,
right? And
what is it that people are most interested in, and just talk about that a little bit.
Sure.
Yeah.
I think there are a couple of things. Many people ask, why do we care, I guess, about egg freezing? That comes up a lot. Like why, yeah, like why has it become more part of the conversation? It was considered experimental until about 2012, right? And now we have seen a huge shift from just very few people freezing their eggs back in, let's say, 2014.
I hear about it all the time.
You're hearing about it all the time. Yeah. And the other question is, why is infertility happening much more frequently, right? When I grew up, as I was growing up, it was 1 in 8, and now it's like 1 in 6 worldwide. People are affected by infertility. And I think many things contribute to that. As women are more educated and we're thinking more about our careers and things, we're not necessarily starting our families earlier, right? And so, we're born with all our eggs. They decline in quality and they decline in number over the course of our lives. And so just by biology, that increases those risks. Let's not forget the male fertility piece, right?
Right, of course. It's not just us.
It's not just us. There are factors that can affect sperm quality as well. And so those are kind of like big things that people tend to like talk about, like why. And then, because you feel like you've crushed it in your career, you've crushed it in your education, you should crush it at becoming a mom.
Absolutely. And it's funny, isn't it? Because I completely understand what you say.
Yes.
But it's like that drive, but you can't, to all the warrior women out there, you can't just, it's not the same. I'm glad you're bringing that up.
Absolutely.
Because a lot of women need to hear this. So keep going. I didn't mean to interrupt you, but I thought it was just such an important thing.
Absolutely. And that's one of the things I spend a lot of time doing in my office, is saying, first of all, know that it's not your fault.
Yeah.
Know that it's very common.
I love that.
Know that you're not alone. Right? Women go through miscarriages. We go through, infertility. And it is hard. And because we crushed it at whatever else, doesn't mean we're gonna crush it here. And you know what? We have options. And so that's my job, is to like help give that hope, redirect, and give people options. The option might be donor egg for someone. The option might be IVF for someone else. The option might be, okay, this is not for me. I'm gonna walk away and be happy with however, like whatever that looks like. And you mentioned the mental health piece.
It's so important.
It's so important. And that's why I always have like cards and things for therapists. But we have our own internal yes, we have our psychologists on file on they usually will see patients virtually. We have genetics counselors, there's so much support. And again, that goes back to Dr. Tran and Dr. Klasky, seeing those needs early on and really bringing people on like myself who really believe in that mission.
I love this.
Yeah.
So needed. Especially that, these decision points. Yeah. I feel that, because we've worked with a lot of women in healthcare, and I see a lot of times that women are so ready to give their opinion or answer, and they're not doctors. Oh, well, you should just adopt. Oh, yeah. You should just adopt, or you should just do this. Yeah. But I think it's so important what we're talking about today is to understand your options and solutions. And I like in the beginning when you talked about the individual care, because everybody's not the same.
We're not the same.
So you can't give the same answer.
Yeah, absolutely. And sometimes people assume something. Oh, one of the bigger things I see is, well, my aunt had a baby at 50. That's your aunt. There's no reason to believe that we're going to be the exception. Right?
Yeah, no, I've heard the same.
Yes, and so the false reassurance, and also like there's so many myths and things. We do a lot of myth busting. Yeah, and really trying to like help people to get to where they need to be, like in your mental space.
In your mental space. I love this. So I have a couple other questions. So you talked a lot about the different solutions that you provide. Is there any specific treatments that you want to talk about that are proven, developing, common? Just a little bit about treatments.
Sure. And so pretty much proven treatments for infertility are going to be like IVF is our most successful method. It's been really the first IVF baby was born in 1978. So if you think about it,
really,
that person's not even 50 years old, right?
I didn't know this. Yeah.
Yes. So our field is still new, very new, and it's growing, and so that's important because we don't have answers to everything. Yeah. We can't say why a beautiful embryo that's been genetically been tested, looks normal, doesn't implant every single time. Right. There are other factors that are potentially contributing, and those are areas of ongoing research. We have come obviously a very long way to know our field. Absolutely. Basically, we do single embryo transfer, which has reduced the risk of twins, triplets, multiples, which are much higher risk pregnancies. Right.
I remember that. I hate to interrupt you, but I remember in I don't know, 15, 20 years ago, I had two friends that did IVF, and they both had, I think one had triplets and the other had 4.
Really? Yeah.
And I remember being scared of that because of that. Yes. So that's really interesting. I actually didn't even know it was so new.
Yes. Yes. So back when the methods just weren't as I would say effective,
Yeah.
we would throw in a bunch of embryos and hope.
Oh God.
These days we don't do that. We put
Wow.
one embryo in.
That's good.
Because oftentimes we can do genetic testing and kind of know, like,
Yeah.
okay, this embryo is chromosomally balanced. It has a very high chance of implanting and ending in a live birth. And so that really helps to have a safe, healthy pregnancy for that mom and for that baby. And just for that family, like, it's really hard to have two babies at one time.
I can't imagine. I can't imagine.
Right. And just like physically
very hard.
better. Yes.
Yeah.
So that's come a long way. And like I said, egg freezing was experimental until 2012.
Yeah.
And since that experimental label has come off, because the freeze thaw methods have become so good and so reliable, that's really opened the doors for a lot of people. Like we mentioned, even just cancer treatment or whatnot, to freeze their
probably they thought they would never be able to have children.
Precisely.
That's amazing.
Yeah.
No, it really
Exactly.
is.
So
I love
really
that.
opened a lot of doors.
Okay. Before I jump on to a couple other questions, any resources you want to share in terms of educational resources that people can look at?
Yes, I would say obviously their Spring Fertility website has a lot of information about fertility treatments and so on. The American Society for Reproductive Medicine is our governing body. It has information for patients about so many things, recurrent pregnancy loss, those are kind of like the main sources.
That's fine. Just so if people are now more interested, which they should be.
Yes.
It's good for them to be able, people love to do medical research.
Yes.
I think it's
right. And if you're looking
the most thing that people research online is medical.
Absolutely.
It is. It's health.
Right.
It's always been that way. And that's good.
Yeah, it's good. I think there's
as long as
there's some things that are not good resources.
As they, of course, as long as they consult.
Absolutely.
Right.
Your OB/GYN and see an REI.
Yeah. Are there any common questions that you get from your patients, like on a consult?
Yes, common questions. How much time do I have? Which I can't tell you, right? How much time do I have?
Oh, right.
Am I fertile?
You're the oracle.
Right. These are questions I can't answer.
Tell me. Yeah.
Let's say someone has their blood work done. So there's a hormone test called AMH. That blood test gives us a sense of our overall egg reserve.
Okay.
If that hormone level is low, then you have a low egg reserve. It's high, you have a high egg reserve.
Okay.
However, outside of someone trying to conceive and having difficulty conceiving, like with infertility, all it tells me is how many eggs I may be able to retrieve, egg retrieval.
Right.
It tells me nothing about when you will go through menopause. Right.
So interesting.
So I can't say how much time you have. All I can say is right now in this moment, the reserve is low or high.
Yeah.
So
how are they able to, I guess they're not able to find that answer.
Right. Unless family history, multiple people have gone through menopause early. Like that's why we spend so much time with the history. However, that number gives us a sense of, all right, should I action now for that egg freeze? Like I was thinking about freezing my eggs at 30.
That's right.
And I see that my reserve is low. Maybe I should do it now. Right?
Yeah.
If the reserve is high, maybe I'll check again in a year when I feel more ready. Yeah. Right? So it gives people a sense of like that urgency.
Yeah.
And I think that's valid. But I can't tell you.
Is that something you recommend for all your patients? Or is that
just to check? I would recommend
I'm just wondering. It seems like it should be part of
routine GYN care
plan.
And I do have many gynecologists who will do that. They will just check, and if it's low, they'll send them for a consultation just to have a conversation.
Yeah, I think that's so
Yeah.
Okay, so we have a couple questions left. So talked about balancing as a woman business owner. Let's talk about you as a woman in business for a second. Okay. Never mind being a doctor.
Right.
There's so many things that you do. Yeah. So, what's important to you as a career woman in your profession? Yeah, talk about that a little bit.
I think it's really important to have support, like a team that can support the mission.
Yes.
Right? That's the most important thing.
Yes. Because I'm so emphatic about it. You don't even know. Yes.
You can't do everything. You can't know everything.
Oh my God, no, you can't.
You need for us in medicine, you need expert nurses. You need a front desk staff that's going to be kind, friendly, like empathetic.
Yeah.
Patients are going through all kinds of things. And so you need a team. And I'm lucky to have that kind of a team around me. For the balancing act, childcare.
The
Childcare, family, a partner who is also supportive.
A partner who's
all of those things, because, as I said before, like, look, we are used to doing well. Like we work hard
and make it
and,
happen.
but we're just one person.
Yep.
And it's okay. I think it's very important to realize that we can't do it all.
Mhm.
And that we do need a team of people to make it happen. And I realize that more and more each day.
Me too. Every single day. Every single day.
Yeah,
and I think women are the tribe personally that can help other women.
Absolutely.
That's why I was so excited when I walked in the door and I saw the women.
So many women. Yeah.
I think that every patient probably gets excited.
Yes, they do.
Because
it's not, they don't see that every day.
No.
And so it's kind of fun to have that opportunity.
Yeah.
And I think it's also important to take care of our mental health, right? I say have a therapist, talk to them, because
absolutely
you carry so much that you don't even realize you're carrying.
Yeah.
And so offload and just have a chat with someone who is
a healthier society.
We'll have a healthier society.
In a very good way. Okay, good. I like that. Okay, so my question I ask all of my guests.
Okay.
What does the term warrior women mean to you? When you heard it, what kind of visually came to mind?
Yeah. A warrior woman is someone, in my eyes, who is willing to go up against all the odds, right?
I like that.
You're gonna show up in the room that you're not expected.
I like that too. I like that too.
For me personally, on a day-to-day, I am, advocating for my patients. If someone came to me because she really wants to grow her family and we've done a cycle and maybe it's not the best cycle, we're going to look at ways we can make that better. Right. I'm going to fight for you.
Yes. Advocate.
Right. I'm going to advocate for you. You show up in a room and you may not be the person that someone else notices or expects. And you know what? You crush it.
Yeah.
Right?
Yes.
So
I do know. In about a billion ways.
I know that you know.
Yeah.
So yeah, things I think, come to mind.
I like that
fight.
I like that. So one last question. What actionable advice would you have to those that are watching, those that are listening about starting a family?
Yes. I think this is very important. Starting a family, whether that looks like today, tomorrow, if you've been trying for a while, get checked. Just have an evaluation.
Sure.
Talk to your gynecologist. Just be open about it. I think one of the biggest things with fertility or infertility is stigma and fighting that stigma. I love that we're talking more about it these days, but there's still pockets of people who are afraid to speak about it.
Absolutely.
Just speak out, let people know, because it's very common that people have trouble. And as you said before, sometimes the advice is really ill-advised.
It is.
And so speak to the people who can potentially be helpful. Speak to your gynecologist. If their answers aren't particularly helpful to you, you can seek a specialist, right?
Yeah.
See a specialist like myself, a reproductive endocrinologist, a fertility doctor. And, I would also say, don't fear. Fear is a factor that keeps people back.
Absolutely.
Maybe they're afraid of injections or whatever the case may be.
The blood work room.
Right.
No, that's just me. Sorry.
No, it's not just you. But just have a conversation and know that there are no obligations, right? No one's going to make you do something. It's your body. These are your choices.
That's also such an important point. So it's your body.
It's your body.
Yeah.
And these are your choices.
Yeah.
And if you don't have the options, if you don't have the conversation, you will never get the answers you're looking for. So at least give yourself that opportunity is my advice. Seek have a consultation.
I love that.
Yeah.
Because what is interesting, and thank you for that lengthy answer, because it was it was so important.
Yeah.
Because going back to the opinions, I think I think, because I've run panels with doctors, right? I think a lot of women are giving their opinion based on what they go through,
Their
that
own
experience,
Mhm.
and then that can taint or drive some bias.
Absolutely.
And I think what you're providing is just so important because you're an advocate.
Right. Let's strip away all the bias, strip away
Yeah.
other people's experiences, and let's talk about you.
I love that.
Yeah.
So anything important that's coming up at spring, and most importantly, how can our listeners and our audience get in touch with you?
Absolutely. So Spring Fertility is celebrating 10 years, and so our 10,000 futures, that's happening right now.
I love that.
And Spring Fertility Long Island is turning 1 year old.
Oh, the baby.
Yeah, we're the baby. We're the baby. So we're excited about that. And we're excited to grow. And so we're, obviously accepting patients. So if anyone's looking to have a consultation, they can, find us on thespringfertility.com. You can also connect with me directly outside of medicine. Outside of Spring, on LinkedIn or on Instagram.
We'll share all of that in the show notes.
So that's basically it.
Listen, I want to thank you for coming on to the podcast.
Yeah, and thank you for having me.
It's such an important topic.
I think so. It's a pleasure. Thank you for speaking about this.
Yeah, absolutely.
Thank you.
All right, we're signing off now from such an important episode today. And I hope all of you who are considering starting a family, or maybe you're having trouble, consider Spring and Dr. Chantae Sullivan-Pyke here at the office. And she's given some great resources, but certainly visit the website. We'll put that in the show notes. A couple things I want to mention that are coming up that we're really excited about. We're women, we're always trying to do fun and interesting things. So we are actually partnering for New York Fashion Week this year. Yeah. So we'll be making a big announcement about that next week. We also are doing an event for those of you that love dogs, the paw rents that are out there in life. We're going to be hosting a very big dog rescue event in Brooklyn, and that will be being announced soon. So just check out warriorwomenbusiness.com. Again, my name is Jasmine Sandler. Thank you so much for joining us, and we'll see you next time.